If you are a firm over 100 employees, the bigger firms, they're going to offer health insurance. If they offer health insurance, what could I do so that people don't enroll in my plan? Because then I could keep all of that employer contribution. That's like $15,000. And so if I have a married worker, maybe I could shunt them over to that other company's, their spouse's plan. And so how does the game work? We just don't see this. We think, okay, I insure my workers. But no, that's not the way it works. At least a quarter of workers at large firms are getting their insurance through another big firm. So we're looking at a few different things. So one of the ones is tobacco smoking surcharges, a premium surcharge. So if you smoke, or your spouse smokes, or any of your dependents smoke, I can charge you up to an additional 50% on your health insurance premiums. Well, is this to discourage smoking? Or is it just a way to discourage smokers from enrolling in my plan? Because smokers turn out not to have high insurance costs due to smoking. All that comes up later, pretty much when you're on Medicare. But a lot of us who smoke have additional chronic conditions. That's why we smoke. I have a mental health condition. That's why I smoke. And those can be very expensive. So the smoking is just an easy way to flag, this is a high expense employee. Could I discourage them from my plan, put them on someone else's plan? We'll never switch over to a taxpayer finance system. It's just, we don't have the stomach for high taxes. But we could have premium-based purchasing into a public plan. So instead of a single payer system, what if you just let a government plan compete? So one of the options is talked about, what if small businesses could buy into the state employee health insurance plan? Or even cheaper, Medicaid. Medicaid is stunningly efficient. And it is comprehensive coverage. The reason it is so efficient is it has extremely lean overhead and it doesn't pay high fees. So you can offer this very high coverage for a lot less money. But then you run into the problem of, how do you pay for all these hospitals? In a not-for-profit, the money is spent. So if we cut spending, how do I pay for what I have already spent? And that's why we've never done healthcare reform. We talk about who pays, but we don't talk about how much, because that's a lot harder debate.